I want you to picture something for a moment. Picture a tiny, humble little seed. Smaller than a watermelon seed, cheaper than a cup of coffee, and sitting on the shelf of almost every grocery store in this country. Most people walk right past it. Some people have a bag of it in their pantry right now and have no idea what it can do. And I'm going to tell you today that little seed might be one of the most powerful things you can put in your body after the age of 60, especially when it comes to your heart and your arteries. My name is Dr. Robert Hayes. I've been practicing internal medicine and preventive cardiology for nearly 30 years. I've sat across from thousands of patients, men and women in their 60s, 70s, and beyond. And I've watched what happens when people ignore their cardiovascular health. And I've watched what happens when they take it seriously. And in all my years of practice, very few things have surprised me as consistently as the research on this one seed. So today, I'm going to show you exactly what it is, exactly what the science says it does, and exactly how to use it. And I promise you, by the end of this video, you'll never look at your morning routine the same way again. If you're new here, do me a favor right now. Hit that subscribe button and ring that bell so you don't miss what's coming next. I put out new videos every week on exactly this kind of practical, evidence-based health information. And I don't want you to miss a single one. Now, before I tell you what the seed is, I want to explain why this matters so much, especially for those of you who are 60 or older. Because what's happening inside your arteries right now, at this very moment, is something most people never think about until it's almost too late. And that's the problem. Your arteries are not pipes. I want you to understand that. They're not rigid, fixed tubes like the plumbing in your house. They are living tissue. They're flexible. They're responsive. They contract and expand with every single heartbeat. A healthy artery is like a brand new garden hose, smooth on the inside, flexible, strong, moving blood effortlessly from your heart to every organ in your body. Now imagine what happens to that garden hose when you leave it outside for 20, 30, 40 years. It gets stiff, it gets brittle, cracks start to form on the inside. That's essentially what atherosclerosis is, the slow, progressive hardening and narrowing of your arteries due to buildup of plaque, inflammation, and oxidative damage. And here's the part that should wake you up. It doesn't hurt. Not until it's already in an advanced stage. Your arteries can be 50, 60, even 70% narrowed before you feel a single symptom. That's what makes this condition so dangerous and so underestimated. And after the age of 60, your body's ability to fight back against this process changes. Your antioxidant defenses aren't what they were at 35. Your inflammatory response is more easily triggered. Your LDL cholesterol, that's the bad kind, oxidizes faster. Your arterial walls become less elastic. You're not working with the same tools you used to have. So if you're sitting there thinking, well, I feel fine, I need you to hear me loud and clear. Feeling fine is not the same as being fine. The heart gives you warnings, chest pain, pressure, shortness of breath. But the arteries? They go quiet. And that silence is deceptive. Now here's where it gets interesting. Because the research, years and years of it, from universities and clinical trials and major cardiovascular journals, has been pointing to a small group of foods that can genuinely, measurably help protect and support arterial health. And one of them is right there in your grocery store. Has been for decades. And most people have no idea. Today, I've put together what I believe are the 4 most important benefits of this seed for your heart and arteries. 4 ways it works, 4 reasons it matters, and for every single one, I'm going to give you the full picture. What the evidence shows, what the risks are, and what you can actually do about it. Because my job isn't just to give you good news. My job is to give you the truth. And the truth, in this case, is both encouraging and something you need to handle with care. The seed I'm talking about is flaxseed, ground flaxseed, 1 tablespoon, every morning, on an empty stomach. And let me tell you why. Benefit number 4, and I'm starting here because most people don't even think about this one, is that flaxseed is one of the richest plant-based sources of omega-3 fatty acids on the planet. Specifically, a type called ALA, alpha-linolenic acid. Now, when most people hear omega-3, they think of fish oil. And fish oil is great. I'm not arguing with that. But here's what most people don't realize. Flaxseed contains more ALA per gram than almost any other plant food in existence. About 22% of whole flaxseed by weight is this omega-3 fatty acid. And this matters enormously for your arteries. Here's the mechanism, and I want you to really understand this, not just take my word for it. Think of your arterial wall like a neighborhood. A healthy neighborhood has good infrastructure, well-maintained roads, low crime. Now picture what chronic inflammation does to that neighborhood. It's like a slow-moving storm that never fully clears. The streets start breaking down. Walls develop cracks. Over time, the damage accumulates. That inflammation in your arterial walls is one of the primary drivers of plaque formation and cardiovascular disease. And ALA, the omega-3 in flaxseed, is one of the most effective natural anti-inflammatory compounds we know of from the plant kingdom. It works by reducing the production of inflammatory molecules in the body, including something called C-reactive protein, or CRP, and tumor necrosis factor alpha. I call it the inflammation amplifier. When those levels come down, your arterial walls start to breathe again. The research on this is compelling. Studies have consistently shown that regular ALA intake is associated with lower prevalence of atherosclerotic plaque buildup, better arterial flexibility, and improved blood flow. One landmark study even showed that a diet supplemented with flaxseed preserved vascular relaxation in subjects who were eating a high-cholesterol diet, meaning the flaxseed was fighting back against the damage being caused by the diet itself. That's remarkable. Now the benefits here include reduced arterial inflammation over time, improved flexibility and elasticity of the arterial wall, lower risk of plaque progression, better blood flow and circulation, and stronger protection against oxidative damage to your vascular system. Those are real, measurable, science-backed benefits. But I want to be honest with you, because this is important. There are some things you need to be aware of. First, flaxseed is not a medicine. It is a food with powerful bioactive properties, and it works best as part of a broader healthy lifestyle, not as a replacement for it. Second, if you're on blood thinners like warfarin or aspirin therapy, you need to talk to your doctor before adding flaxseed to your routine, because ALA has mild anticoagulant properties. It can reduce the tendency for blood to clot, which is generally beneficial, but in combination with blood-thinning medications, it requires monitoring. Third, for some people, the conversion of ALA in the body into its more active forms, EPA and DHA, is limited. So flaxseed is excellent, but it works best in combination with a good overall dietary pattern. Write this down. ALA from flaxseed is nature's anti-inflammatory for your arteries. 1 tablespoon a day keeps the fire inside your blood vessels from burning out of control. Benefit number 3, and this one is controversial because people do not want to hear it, is what flaxseed does to your cholesterol. And I mean really does. Not in a theoretical, someday maybe kind of way, in a clinically documented, randomized controlled trial kind of way. Let me paint you a picture. Your bloodstream is like a river. A healthy river runs clear. Water flows freely. Nothing blocks the current. Everything moves as it should. Now imagine that over the years, someone starts dumping waxy, sticky debris into that river. Slowly, it starts to coat the walls of the riverbanks. It builds up. It narrows the channel. That debris is LDL cholesterol, the bad kind. And when it oxidizes, when it gets combined with inflammation, it becomes the primary raw material of arterial plaque. And the higher your LDL, the faster that plaque builds. Now here's what the science shows about flaxseed. A major meta-analysis, that's a study of studies, pulling together the results from dozens of randomized clinical trials, found that regular flaxseed consumption significantly reduces total cholesterol and LDL cholesterol levels. One of the most impressive clinical trials looked at patients who already had peripheral artery disease, people whose arteries were already in trouble, and found that dietary flaxseed produced a 15% reduction in circulating LDL cholesterol within just 1 month of starting supplementation. 1 month, 15%. And in another study using 40 grams of ground flaxseed daily, LDL dropped by 13% in just 5 weeks. These are not trivial numbers. These are clinically meaningful reductions. How does it work? 3 ways. First, flaxseed is loaded with soluble fiber, the kind that forms a thick, gel-like substance in your digestive tract, which physically binds to cholesterol and bile acids and removes them from your body before they can be reabsorbed. Think of that fiber as a sponge, soaking up the bad stuff before it ever gets a chance to cause harm. Second, the lignans in flaxseed. These are plant compounds called SDG, secoisolericyresinol diglucoside, and I call them the cholesterol moderators, have been shown to lower LDL and raise HDL, the good cholesterol. Third, the ALA we already talked about contributes to reducing LDL oxidation, which means that even the cholesterol that does remain in your bloodstream is less likely to become the kind that sticks to arterial walls. The benefits here are clear. Lower LDL cholesterol, higher HDL cholesterol, less LDL oxidation, reduced bile acid recirculation, and a meaningful slowing of plaque accumulation. That's 5 distinct mechanisms working simultaneously every single time you eat this seed. But here is what I need you to hear on this point. If you are currently taking a statin, a cholesterol-lowering medication, please do not stop taking it without talking to your doctor first. Flaxseed can complement your medication beautifully, and in fact, one study found that flaxseed lowered LDL beyond what statins alone could achieve when the two were combined. But the decision to adjust or discontinue medication is never yours to make alone. That's a conversation between you and your physician. Additionally, the effect of flaxseed on cholesterol appears to be most pronounced in women, particularly postmenopausal women, and in individuals who already have elevated cholesterol levels. If your cholesterol is already well controlled, the impact may be more modest. Write this down. Flaxseed fiber is a sponge for bad cholesterol. Every morning, Spoonful is one less brick in the wall that's narrowing your arteries. Benefit number 2, and I call this the most underestimated benefit on this entire list, is what flaxseed does to your blood pressure. And I need you to stay with me here, because this one has implications for your heart that go far beyond what most people realize. High blood pressure, hypertension, is sometimes called the silent killer, and that label is earned. It has no symptoms in the early stages. You can walk around for years with blood pressure that is slowly, steadily damaging the inside of your arterial walls, straining your heart muscle and setting the stage for a stroke or a heart attack, and feel perfectly normal the entire time. According to major health data, tens of millions of adults in this country have elevated blood pressure, and a significant portion of them don't know it, or know it and aren't managing it effectively. Now, Here's why flaxseed matters for blood pressure specifically. Think of your arteries as a pressurized system. When you have too much resistance in that system, when your arterial walls are stiff, when inflammation has narrowed the channels, when the walls have lost their elasticity, your heart has to work harder to push blood through. That extra workload, sustained over years and decades, damages the heart muscle and accelerates atherosclerosis. It's a vicious cycle. And what flaxseed does, through multiple mechanisms, is help that system relax. The research is striking. A clinical study found that flaxseed supplementation over 12 weeks significantly reduced both systolic and diastolic blood pressure in hypertensive patients. The two numbers in your blood pressure reading. Systolic reductions of up to 15 millimeters of mercury have been documented. To put that in context, a 10-millimeter drop in systolic blood pressure is estimated to reduce the risk of stroke by about 40% and heart attack by about 25%. That's the kind of impact we usually associate with medication. How does flaxseed lower blood pressure? 5 specific ways. First, the lignans in flaxseed have estrogen-like activity in the body that promotes vasodilation. That's the widening of blood vessels, and reduces arterial stiffness. Second, the peptides in flaxseed, the protein fragments released during digestion, have been found to act as natural ACE inhibitors. Now, ACE inhibitors are a major class of blood pressure medication. The fact that flaxseed contains natural compounds that work through the same pathway is genuinely significant. Third, the ALA content helps preserve vascular relaxation, meaning your arteries stay more supple and responsive. Fourth, the soluble fiber slows the absorption of sugars, which reduces blood sugar spikes, which in turn reduces the insulin surges that contribute to arterial stiffness. Fifth, the anti-inflammatory action we already discussed reduces the underlying inflammation that drives hypertension in the first place. Now, the risks here are important to acknowledge. If you are already taking blood pressure medication, ACE inhibitors, beta blockers, calcium channel blockers, diuretics, flaxseed may enhance those effects. That's not inherently bad, but it needs to be monitored. Your doctor may want to adjust your dose over time if you begin a consistent flaxseed routine and your blood pressure responds meaningfully. The goal is not to drop your blood pressure too low. That carries its own risks. So again, do this with your physician's knowledge, not behind their back. Write this down. Flaxseed is a natural ACE inhibitor. It tells your arteries to relax, and a relaxed artery is a healthy artery. And now we come to benefit number 1, the one I've been building toward this entire video. And I need you to take a breath, because what I'm about to tell you is, in my opinion, after nearly 30 years in medicine, the single most important and most overlooked aspect of flaxseed's power for cardiovascular health in older adults. I need you to really hear this next one. I need you to understand what atherosclerosis actually is at its core. Not just the cholesterol, not just the blood pressure, but the full picture. Because most people think of arterial plaque as just a buildup of fat. And that's part of it. But the real mechanism is far more complex and far more dangerous. Here's what's really happening inside your body. Picture a battlefield. Your arterial wall is the terrain. The enemies are oxidized LDL cholesterol, inflammatory molecules, and free radicals, unstable molecules that tear through your arterial lining like microscopic wrecking balls. When your arterial wall gets damaged, by inflammation, by high blood pressure, by oxidative stress, it sends out a distress signal. White blood cells rush in to fix the damage, but in doing so, they engulf the oxidized LDL. They become what are called foam cells. Foam cells accumulate under the arterial lining, forming the fatty streaks that are the earliest stage of plaque. Over time, those plaques grow, harden, calcify, and narrow the artery. And if a plaque ruptures, if it breaks open, the blood clots that form in response are what cause heart attacks and strokes. That's the real mechanism. That's what you're fighting. Now, the number one benefit of flaxseed, the benefit I've saved for last because it encompasses everything we've talked about, is its combined antioxidant, anti-inflammatory, and lignin-mediated activity that directly suppresses the development and progression of atherosclerosis. This is not speculation. This is documented in the research at a level that genuinely surprised me when I first encountered it. In studies using animal models, flaxseed and its lignin complexes reduce the development of atherosclerosis by anywhere from 34 to 73%. Research on the lignin component specifically showed that it slows the progression of plaque formation. The mechanism involves multiple simultaneous attacks on the disease process. It suppresses the oxidation of LDL, which means less foam cell formation. It reduces the inflammatory signaling that recruits those white blood cells to the arterial wall in the first place. It improves the ratio of good to bad cholesterol in the bloodstream. It reduces circulating triglycerides, and it helps maintain the structural integrity of the arterial lining so that the distress signals that start the whole cascade are less likely to be sent. I want you to imagine what it looks like when you melt sugar in a pan. It starts clear, then turns golden, then amber, then dark brown, and eventually it burns, sticking to the pan, hardening, nearly impossible to remove. That's essentially what happens to oxidized LDL in your arterial wall. It sticks, it hardens, it triggers a cascade of damage that, over years, becomes a heart attack or a stroke waiting to happen. Flaxseed, through its lignins and ALA and fiber working together, interrupts that process at multiple points simultaneously. It's not one lock and one key. It's one key that opens 5 different locks at once. In nearly 30 years of medicine, I can tell you with absolute certainty that I have never seen a single food that addresses cardiovascular risk from this many angles simultaneously. And it costs about $2 at the grocery store. Now let me give you the full benefit picture for this number one finding, followed by the honest risks, because both matter. The benefits: it directly suppresses atherosclerotic plaque development, it reduces LDL oxidation at the source, it lowers circulating triglycerides, it improves arterial lining integrity, and it works synergistically with, and in some cases beyond, the effects of cholesterol-lowering medications. The risks and cautions, and these are real, and I am not going to skip over them. If you are pregnant or breastfeeding, do not take flaxseed without your doctor's guidance. It contains compounds that can affect hormone levels. If you have a hormone-sensitive condition, certain cancers, or if you're on hormone replacement therapy, this is especially important to discuss with your physician before starting. If you're on anticoagulant therapy, blood thinners like warfarin, the mild blood-thinning effect of flaxseed's ALA requires monitoring. If you have a flaxseed allergy, rare, but it exists, obviously do not consume it. And if you take large amounts without enough water, you can cause digestive problems including constipation or blockage, because the fiber absorbs water. Always drink a full glass of water when you take your morning flaxseed. And do not eat raw or unripe flax seeds. Always consume them in their ground form, because whole flax seeds pass through the digestive system largely undigested, and you'll lose most of the benefit. Now, I know that's a lot, and I understand if it feels like a lot to take in. You came here looking for good news about a simple seed, and I've given you both the good news and the full picture. That's how I was trained, and that's how I practice medicine, with honesty, not just reassurance. But here's the genuinely good news. The good news is this: you don't need a prescription. You don't need a specialist. You don't need an expensive supplement. You need 1 tablespoon of ground flaxseed every morning, ideally on an empty stomach or mixed into a small amount of water or yogurt or a smoothie. That's it. The research shows benefits beginning to emerge within 3 to 4 weeks of consistent daily use. The studies that showed the most significant cardiovascular effects used between 1 and 2 tablespoons daily. Start with 1. Be consistent and be patient, because this is not a quick fix. This is a slow, steady, powerful intervention that works with your biology, not against it. Here is your 5-step morning protocol, and I want you to follow this as closely as you can. Step 1. Buy ground flaxseed, not whole. Ground, also called milled or flaxseed meal. The outer shell of a whole flaxseed is too hard for your body to break down effectively, and you will lose most of the nutritional benefit. Step 2. Store it in the refrigerator or freezer after opening. Flaxseed is rich in delicate fats that can oxidize and go rancid at room temperature, especially after grinding. A rancid fat is worse than no fat at all. Keep it cold. Step 3. Every morning, take 1 tablespoon, about 10 grams, and mix it into a glass of water, a yogurt, a smoothie, or oatmeal. Do this before or with your first meal of the day. Step 4. Drink a full glass of water immediately after or alongside it. The soluble fiber in flaxseed needs water to work properly, and without adequate hydration, you can experience bloating or digestive discomfort. Step 5. Be consistent for at least 21 days before you expect to see measurable changes. That's when the research shows the early cholesterol and blood pressure effects beginning to emerge. After 12 weeks of consistent use, the benefits become more substantial. This is a long game, and you're playing it. One more thing I want to address before I close, and it's important. Flaxseed is not magic. I want to be absolutely clear about that. No single food is magic. The research on flaxseed is genuinely impressive, but it is most effective when it's part of a lifestyle that includes regular physical activity, a diet low in refined sugars and processed foods, adequate sleep, stress management, and appropriate medical care. If you're smoking, flaxseed will not undo the damage. If you're eating fast food 3 times a day, 1 tablespoon of ground flax will not balance that equation. Use this as a tool, a genuinely powerful, science-backed, remarkably accessible tool, but use it as part of a larger commitment to your health. And I want you to think about something. Every morning, when you mix that tablespoon of ground flaxseed into your water or your yogurt, you are making a choice. A small, quiet, humble choice that most people around you won't even notice. But inside your body, that choice is meaningful. Your arterial walls are a little less inflamed. Your LDL cholesterol is a little harder to oxidize. Your blood vessels are a little more relaxed. It doesn't feel dramatic. You won't feel a surge of energy or a sudden change. But over weeks and months, that consistent, daily, unspectacular choice compounds into something real. Something measurable, something that might be the difference between a heart attack at 72 and a healthy 80th birthday surrounded by the people you love. That's not a small thing. That is everything. We've covered a lot of ground today, folks, and I'm genuinely glad you stuck with me. Let's pull it together. We talked about 4 major benefits of ground flaxseed for your heart and arteries. Number 4, its omega-3 ALA content fights the arterial inflammation that drives plaque formation in the first place. Number 3, its fiber and lignans lower LDL cholesterol through multiple simultaneous mechanisms. Number 2, its natural ACE inhibitor peptides and vasodilating lignans reduce blood pressure with clinical significance.